Thank you for your interest in the intervention method services offered through the SDSU HealthLINK Center for Transdisciplinary Health Disparities Research. This video will provide a brief overview of the services we offer and how you can utilize these services for your research. As you consider the services available as part of the intervention methods group, it is important to consider the specific methods available and both the value and fit with your project or training needs. Our group offers training and consultation and methods to aid in the development and implementation of behavioral interventions that are important to enhancing its relevance and effectiveness in its intended delivery setting or context. Following a systematic evidence-based approach to designing and adapting interventions or conducting formative research to inform intervention development will enhance the credibility of your results and make the methods replicable for other researchers who are looking to do similar research or build upon your research. Additionally, systematic and evidence-based approaches to intervention development will be extremely valuable to conducting a process evaluation, aiming to evaluate influences and outcomes of interventions during the process of implementation. This is important to know if your intervention was implemented as it was intended and the reason for your study's outcomes. All of these provide you with the most appropriate information to design your studies and interventions. Meet the intervention methods team. Alva Arredondo is a professor of psychology here at SDSU and co-lead of the intervention methods group. Dr. Arredondo is a bilingual, bicultural native of Mexico with over 18 years of research experience in developing, implementing, and evaluating multi-level community-based programs that improve the health of ethnic minority and socially economically disadvantaged communities. She has served as PI, MPI, or subcontract PI of 19 grants. Her research has resulted in over 160 manuscripts, book chapters, and scientific entries. She has also received training in implementation science as part of the NIH-sponsored mentored training for dissemination and implementation research in cancer and the Training Institute for Dissemination and Implementation Research in Health. Kelsey Dixon is an associate professor of child and family development here at SDSU and research scientist at the Child and Adolescent Services Research Center and co-lead of the intervention methods group. Dr. Dixon is an implementation scientist with expertise in community-partnered services and implementation research aiming to improve the translation and implementation of evidence-based interventions in community settings, with an emphasis on psychosocial and mental health interventions. Her work also aims to improve equity and access to care for underserved and underrepresented populations, including through the application of implementation science frameworks. Dr. Dixon has experience providing training and mentoring, particularly peer mentoring, in the area of implementation science. So what do? We support researchers seeking to develop new or adapt existing evidence-based behavioral interventions through the use of qualitative research methods. We provide consultation on intervention development and adaptation, as well as implementation evaluation and process evaluation. We can also provide consultation on formative assessment and mixed methods approaches to research. Lastly, we can provide consultation on your focus group and in-depth interview guides, as well as provide verbal and written feedback on these guides. We also offer training in a variety of intervention methods. This includes an in-depth training on intervention mapping, where we review a 6-step process for adapting existing interventions. We can also provide training on implementation mapping, which expands on intervention mapping step 5 and provides a systematic process for developing strategies to improve the adoption, implementation, and maintenance of evidence-based interventions in real-world settings. Lastly, we can provide you and your research team training and conducting focus group and in-depth interviews, where we will review strategies for engaging participants, mock practice, and feedback on the mock practices. As an optional training, we can also guide your team through using rapid analysis for analyzing the qualitative data gathered through your focus groups and in-depth interviews. We are able to provide you with meeting minutes from your consultation meetings with IMG co-leads, written and verbal feedback on your focus group guides, in-depth interview guides, and your data analysis interpretations. If you request training services, you and your research team will receive access to the training and relevant training materials. There are some services we cannot offer. For example, we cannot assist your team with recruitment for your studies. However, if you need to contact with a community partner as a research site, you can contact the Community Engagement Corps. We also do not conduct the focus groups or in-depth interviews. We can happily provide you and your staff with the training to conduct focus groups and interviews. We are also not able to adapt outcome measures or translate them. Please reach out to the Measurement Methods Group for assistance with this if needed. Lastly, we cannot assist with manuscript writing. Again, thank you for your interest in the Intervention Methods services. Please contact our Center Research Manager, Wendy, for more information or any questions. If you would like to inquire about our services, please follow the link to complete our intake form, and an IMG member will be in contact with you soon.